effectiveness of script concordance tests with a 3-point Likert scale compared to open-ended questions in assessing clinical reasoning. This was a study conducted at the College of Medicine, King Faisal University, Saudi Arabia. My name is Dr. Firoz. I am the presenting author, and my co-authors are Dr. Kabiri Firoz, Dr. Saif Al-Dosri, and Dr. Fahad Al-Wadani. The primary form of knowledge assessment in the first 4 years of a problem-based curriculum is single answer, multiple choice questions. For the 4th and 5th year, we add a component of problem-solving questions, which is in the form of open-ended partial credit type of questions. And the open-ended format, although it does test clinical reasoning well, but it suffers from subjectivity in scoring, even if a specified answer key is given. So one of the ways to overcome this is the use of script concordance tests, which are considered to be more reliable in assessing problem-solving abilities as compared to open-ended questions. However, the problem is that the classical 5-anchor Likert scale for assessing SCTs requires more judges, more expertise in making it and judging it, and on the whole, makes it more practically difficult to implement. So the aim of the study was to study the effectiveness of a 3-anchor Likert scale SCT in clinical assessment. So we used a modified 3-point scale-based SCT in exams of 2 specialties, which was dermatology and ophthalmology. And we attempted to evaluate the effectiveness of same in terms of discrimination and difficulty indices as compared to the open-ended questions. So out of total of 30 questions in these 2 specialties for 1 exam, 4 were SCT questions with a 3-point Likert scale. And before this was administered, both the faculty and the students were given adequate training regarding the concept of SCT, how to answer it, and the scoring of the same. The average discrimination index and difficulty index for the SCTs were comparable with that of the open-ended questions, that is for the whole test itself, but it was slightly less as compared to the average for the whole test. And we attribute this to the possible element of guessing, which can be part of the SCT, because in effect, it is like a modified MCQ. So based on our study, we would like to conclude that SCTs can indeed be an effective and more objective method of assessing higher level clinical reasoning and problem solving as compared to open-ended questions. The problems with the classical 5-point SCTs are the practical difficulties in making the questions and assessing the questions. And that can be solved by using a 3-point scale. However, for both of these, the element of guessing needs to be factored in while designing the rest. And also, more studies are required comparing 3-point SCTs with 5-point SCTs to really validate the use of the same. Thank you.